Now for those sushi lovers out there, you should choose soy sauce because it does make a difference in terms of sodium intake. Welcome to the weekly dose of self-care, presented by your neighborhood pharmacist. Today, we're going to share some tips of how to manage high blood pressure in just 5 minutes. There are many reasons why our blood pressure may increase. The first thing we're going to talk about is controlling our sodium intake. If you're able to decrease the amount of roughly 100 millimoles per day, then you can get a drop of roughly 5 for your top number of your blood pressure and probably a decrease by 2 for your lower number. But what is the relationship between sodium and blood pressure? To make it very simple, the higher the sodium that you have in your body, the higher your blood pressure is going to be. But what is the maximum recommended amount of sodium per day? This is from the Canadian Blood Pressure Guideline, where they recommend 2,000 milligrams maximum of sodium intake per day. This is roughly what we had mentioned before about decreasing it by 100 millimoles per day. So, but where would you get your sodium from? The most common source of food is the table salt that we use to flavor food. Now, to make it more practical for you guys, essentially 1 teaspoon of salt is roughly equal to 2,000 milligrams of sodium per day. So again, the maximum amount of salt you can do per day is 1 teaspoon of salt, otherwise you'll go over. Now for those sushi lovers out there, this is just extra information for you. If you ever go to the restaurant, you get to choose between a low sodium soy sauce, which is the green cap, as well as a regular soy sauce or red cap. Then I will recommend to use the green cap low sodium soy sauce because it does make a difference in terms of sodium intake. So per tablespoon of soy sauce, you're actually getting 770 milligrams of sodium from the green cap, but it's roughly 1,160 for the red cap. Unless you have super taste bud, you probably won't be able to tell the difference anyways. Sodium is also found in other food and drinks, so make sure you refer to the back side where it tells you the ingredients as well as how much sodium that you'll be getting. For example, a can of beer will give you roughly 11 milligrams of sodium, or even soda wise, it might give you 75 milligrams of sodium. So if you're on a very tight sodium diet, make sure you do add things up to make sure it's less than 2,000 milligrams per day. Controlling your weight also has an impact on blood pressure. Specifically, if you're able to lose 4.5 kilograms, it will result in a drop of 7 for the top number of your blood pressure and a drop of 5 for your lower number. Not everyone needs to lose weight. In order to find out whether you consider overweight or underweight, you will use this calculator for a body mass index. So you plug in your height, your weight, and it will give you a number. So when you're between 18.5 to 24.9 for your BMI, then you consider normal. If you're greater than 25, then you consider overweight. If you're less than 18.5, you consider underweight. So if you're overweight, then it might be worthwhile trying to lose some weight so you can get more blood pressure control. When people talk about exercise, they usually think about going to the gym or running, but exercise is also considered when you go walking. And walking is something that everybody does per day. So by setting a simple goal, it will help you feel accomplished as well as getting the activity that you require. So the first thing you gotta do is get a pedometer, which will measure the number of steps that you take per day. So you will start with a simple goal of 2,000 steps per day. Then once you have reached that, then you will try to increase it every day by 1,000 steps until you hit a goal of 10,000 steps or more. So there's actually a study done about reaching a goal of 10,000 steps or higher per day. It will actually result in a reduction in your BMI as well as your blood pressure. If you have any feedback or comment about the channel, please comment below. Otherwise, please like and subscribe and turn on notifications. And I'll see you next Saturday at 8 p.m. Bye!